Good Shape, your weekly dose of health information on Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
And with me in the studio today is Dr. Fernando Dimeo. He's a sports doctor here in Berlin. Welcome, Dr. Dimeo, to the show. Does it surprise you that a 53-year-old is in better shape than a 20-year-old?
It does not surprise me. A friend of mine, he's at the army, and he's 63 years old. And sometimes the young troopers say that a task is too long or too stressful or too difficult, and they cannot do that. And he shows them how to do it. And he's by 40 years their senior, 3 times as old as them. But he's able to do that because he kept his whole life exercising and practicing, and he has not lost the physical ability.
Yeah, so he's fitter, but will he live longer? I mean, some studies suggest that people who are living an active life, that they're putting years onto their life, so they live longer.
It's difficult to answer. I know the studies, but it is not clear if people are fitter because they are exercising and therefore living longer, or if they are able to exercise because they have a better predisposition, if they are healthier. And it is difficult to find the difference if it's related to a longer life or to a higher fitness.
Okay, the German sports specialist Wilder Hollmann says that people who are physically active can remain 40 for 20 years. That means that when they are 60, they feel like a 40-year-old. Is that really possible?
It is indeed possible, but it depends on you. If you keep on exercising, if you avoid unhealthy food and you have a healthy lifestyle, of course it's possible. I know a lot of people who are fitter than younger people because they keep to these healthy habits.
But why is that? What does physical activity really do to the body that it can slow down aging?
Because many manifestations of aging are not aging, but are a loss of physical activity because you are not using certain functions. You know, if you don't use it, you lose it. If you stop exercising, if you stop making mathematics, or if you stop playing guitar, you forget how to do it and you are worse. And exactly the same happens with all physical abilities. If you stop exercising, well, you are going to see that you are worse than before. But that is not necessarily related to aging, but to the lack of physical activity.
Just the lack of training. But when it comes to disease, like heart disease, there's plenty of evidence that exercising can prevent heart disease. And some say that it can even prevent cancer. Is there any truth to that?
That is true, and that is related to heart disorders, also to vascular disorders, coronary disorders, for example, and also to cancer. Patients with breast cancer or with colon cancer, they can exercise, and if they exercise, the risk of relapse, of getting again a cancer, is lower. But it had also been shown that people who exercise regularly have a lower risk of these forms of cancer, and therefore we can assume that exercise is protecting them from cancer.
And is there any medical or scientific evidence why exercise can prevent from cancer?
No, it is not clear. In some disorders, for example, heart disorders, it is clear because heart is a muscle, and what you are doing by exercising is exactly the same as you are doing with your arms or with your legs. You get more stronger muscles. Exactly the same happens with the heart. But for other disorders, especially for cancer or for mental disorders like Alzheimer, it is not clear why exercise is helping. What is clear is that exercise and physical activity do help.
Medicine has side effects. What about sports and exercise? Are there any side effects and dangers?
Some people worry about it and think that they can exaggerate and practice too much. But when we consider the huge problem of lack of physical activity, of the conditioning for the whole population, not only in Germany, but in the whole world, to think that it can be harmful and that you can exaggerate, well, that is not the real problem.
But many of my patients in my surgery, in my office, say that if they have any heart attack or heart disease, that they are very scared to go for exercise. But exercise is good for heart disease, isn't it?
It is indeed good, and it has been shown that it is better than surgical interventions, and that you can help patients faster and for a longer time if they decide to exercise than if they don't.
We got a viewer question from Russia. Golden Vasileva from Russia has a father, and her father had a heart attack, and now she wants to know how can she motivate her father to go and put on his sneakers and go for some sports.
Well, the best that he can do is to explain him how it works, and that exercise indeed for him can be very helpful, and that he's going to achieve a higher physical performance, a lower risk of complications, a longer life, and that is the best that he can do. If he understands it, the motivation is going to be there, and he doesn't need an external motivation. He's going to have his own.
To stay young and healthy, you need to exercise. But how much exercise is actually necessary for the positive effect?
The recommendations are worldwide the same, about 2.5 hours per week. And that means about 30, 40 minutes daily of exercise. But what means exercise? Just moving, riding your bike or going for a hike or just having an active lifestyle. And that is going to help at least 30 minutes when you feel you are really doing something, you are using your body.
Okay, everybody should put this into his schedule. It's not that long time.
It's doable. It is indeed doable.
It's doable, yeah. Let's get into some viewer questions we got. Many of our viewers, like Helen Neftalem from Ghana and Mark Young from Scotland, want to know if people have to go to the gym or to the fitness studio, or is just 2.5-hour walk is enough?
For younger people, it's not enough. If you are 75 years old, you don't necessarily need a gym. If you go for a walk daily, if you have a dog, for example, or if you use your bike to move around, it is enough. But younger people need more exercise because they have a higher physical level. They just need more than that. But the most important aspect is do what you like. If you don't like running, for example, then try swimming. If you don't like rowing, well, try aerobics in the group. That is the best source of motivation. Do something that feels good and that you like.
Our viewer Nunzio Moretti from Italy is 50 years old and he has a new girlfriend who likes running. And now his girlfriend wants to take him for a run. Is it okay for him, that's what he asked, to start running with 50?
It's not only it is okay, it can also help him. I know a study with older people, and they could show that after exercising for 3 months, their physical performance was twice as high as before the exercise program. And the most interesting aspect of the study was that the younger patient in the study was 85 years old. And that means that also very old people can improve their physical performance in a short time if they start exercising. Therefore, he could start jogging, and he is going to be surprised, and his girlfriend also.
So it's never too late to start exercising.
It's never
very
too late.
motivating. Thanks to Dr. Dimeo for being with us in the studio. Thank you.
You're very welcome.